Hey guys, welcome to my channel. It's Sean. I'm here today to talk with you about some more drug information that you need to know whenever you get prescribed a new medication. I know sometimes when you go to the doctor or when you go to the pharmacy, you just don't get that time that you need to really get that info to really understand the medications that you take. So today I'm going to talk about the brand name drug Xarelto, which is also called Rivaroxaban. Rivaroxaban is the generic name. So if you're watching this video, maybe you were just prescribed this medication, or maybe you were taking warfarin and now you're transitioning to Rivaroxaban, or maybe you were on a different DOAC, a direct oral anticoagulant, like Eliquis or something, and maybe now you're transitioning to Xarelto because your insurance doesn't cover the old one anymore. So there's a lot of reasons why you may be watching this video, but I'm going to give you everything you need to know about this drug to feel comfortable with it going forward. If you're curious about warfarin or Eliquis, you can check out my other videos to get more information about those. So why listen to me? I was a United States Public Health Service pharmacist for over 5 years. I actually helped run an anticoagulation clinic where we helped people manage their warfarin, manage their Xarelto, and we actually transitioned a lot of people from warfarin to Xarelto, so I have good working knowledge about how this medication works and the little tips and tricks that you need to know. So let's just dive into it. So Xarelto is the brand name and the generic name of this medication is Rivaroxaban. So I'll be using both of those names interchangeably and just know I'm talking about the same thing. So Xarelto is part of the direct oral anticoagulants or DOACs, which started to come out in 2010, and Xarelto was one of the first ones in this class of medications that came out, and Xarelto came out in 2011. So what is Xarelto prescribed for? So it's used to treat most commonly venous thromboembolism, which includes deep vein thrombosis and pulmonary embolism, and it also is used to treat atrial fibrillation, which is an irregular heart rhythm. So it can be used for other conditions, but these are the main conditions that Xarelto is used for. So Xarelto is an anticoagulant, which means it's going to prevent the formation of clots in the bloodstream, so that if you do get a DVT or a pulmonary embolism, or if you have atrial fibrillation, will prevent those clots from forming in the first place and causing more damage that can be serious to your health. So how does Xarelto do this? Well, Xarelto interferes with your body's natural mechanism to create a clot in the first place. So anytime you get an injury, lesion, or cut in your blood vessels, your body will want to plug that lesion, that injury, by creating a clot, and this is normal in most situations, but other situations can cause issues. So if you have a clot that develops in your leg, it could travel up to your lungs and cause a blockage, which could be very dangerous. And then again, if you have atrial fibrillation or an irregular heartbeat, that could form a clot in your heart, which could be sent up to your brain and cause a stroke. We definitely don't want that. So Xarelto is going to help prevent that clot formation, and it does that by binding to a protein or factor that is involved in the coagulation cascade. So the factor that it binds to and inhibits is factor 10A. In Roman numeral, that would be X, so XA, and that's the factor that it binds to, inhibits, and prevents a clot forming because it inhibits that whole cascade. Now, one interesting fact, Xarelto has XA in its name, that's how it's spelled, and then also Rivaroxaban has XA. That's kind of the nomenclature, the way that these drugs were named to help understand the mechanism of action for this drug. So how do people take Xarelto? Xarelto is taken usually once a day for the conditions of venous thromboembolism and atrial fibrillation. So when you start out initially to really bust out the clot, you might take it twice a day, but that is just for a short period of time, and for most of the time you're going to be taking it once a day. So a lot of people will take 20 milligrams once a day, and if you need to adjust the dose because of low kidney function, sometimes you'll take 15 milligrams once a day. This medication is important to take with food. The food actually improves the absorption of this drug in your stomach, and that helps the amount of drug in your bloodstream, which is good because then you'll get more protection from that clot formation. Xarelto begins to work immediately in your system to help prevent clot formation, and it also exits your body pretty quickly. So it is important to take this medication once a day and to not miss a dose. We're all human and we can't be perfect, but do your best to take this every day. You don't want to miss a dose. If you do miss a dose, that can put you at risk for developing a clot because the medication does exit your system pretty quickly. So you want to do your best to remember to take the medication. So what are the side effects of Xarelto? Well, Xarelto helps prevent clot formation, so it puts you at risk for developing bleeds. So the main side effect of this medication is going to be bleeding. Now, I always like to help people understand the risks of bleeding and what to watch out for. So the way that I do it is kind of take it from head to toe and think about the different parts of your body that you could develop a bleed. So starting with your head, you could get a bleed in your brain. We definitely don't want that, but you want to know the signs to watch out for. So a sign of bleeding in your brain would be, very strong, quick onset of dizziness or headache, like a really bad headache. That could be a sign of a bleed in your brain, and we want to address that and seek care if you do notice that. Another sign of bleeding could be in your nose. So if you develop a nosebleed, if you're brushing your teeth and notice bleeding in your gums, you might notice that. You might notice bleeding that starts in your stomach or gastrointestinal tract. So you might notice that by seeing blood in your urine or stool. So if you notice that, you would want to call your doctor to check in and see how to proceed there. You might notice bruising too. So if you bump your body against furniture around the house, you could develop a bruise. With any of these signs of bleeding, you just want to see how severe it is and if it's going away or not. And that's going to determine if you should seek care or not. So with bruising or a bloody nose, if it's just a little bit and it goes away by itself, then you don't need to worry about it. But if it's getting worse and there's more volume of blood or a bigger bruise is growing and growing, that's when you'd want to call your doctor or anticoagulation clinic and see what the next steps are for you. So one thing that's good to know with Xarelto is that, remember, it's part of a family of medications called the direct oral anticoagulants. So each one in that family has its own characteristics. And so Xarelto seems to have the highest incidence of GI bleeding or gastrointestinal bleeding, which means bleeding in your stomach essentially. So out of all the DOACs, Xarelto seems to have the highest risk of GI bleeding. It's still a really safe medication, but just know that it does seem to have a higher risk of GI bleeding. We discussed how to monitor for bleeds. You may be wondering, do I need to check an international normalized ratio or INR? You may be thinking this, especially if you were taking warfarin before. One of the great benefits of Xarelto is that you don't have to check an INR. So no pricking your finger, that's all done with. And so this is a really convenient medication. You might be concerned that if you're not checking an INR, is the medication safe? Is it being effective? If we can't check a test, how do we know it's working? Well, please be rest assured that if you are taking the Xarelto once a day, every day, not missing a dose, it's been proven that it's as effective as warfarin and as safe, and the bleeding risk is comparable to warfarin. So just know that if you're taking it as prescribed, there's no need to check the INR. It's just not doing anything for us. It's not giving us information that's useful. So there's no need to check your INR, and you're good to go there. Now let's talk about interactions that you need to worry about. So there are some drug interactions with Xarelto. Similar to warfarin and the other DOACs, you don't want to take NSAIDs when you're taking Xarelto. So you want to avoid ibuprofen, naproxen, adult strength aspirin. Those are some common over-the-counter NSAIDs that you want to avoid. And if you do have pain or fever or something, just take Tylenol or acetaminophen. There are prescription NSAIDs out there too, like Meloxicam and Diclofenac, and you want to watch out for those too. So always ask your doctor before they prescribe those to you, or let them know that you're taking this blood thinner. When it comes to other prescription interactions, there are some out there, but they're minimal and not very common. So if you have any concerns about that, just always ask your doctor or pharmacist about any concerns for other drug interactions. When it comes to food interactions, you may be wondering if you can eat green leafy foods which have vitamin K. Again, this is more of a concern if you were taking warfarin before. Good news, you don't have to worry about food interactions, and green leafy foods are okay. So how long do people take Xarelto? Well, that's going to depend on your condition. So people that have a deep vein thrombosis or pulmonary embolism, they usually take Xarelto for 3 to 6 months. If you've had multiple clots in your leg or lungs, then some people actually do take Xarelto lifelong. If you have atrial fibrillation or that irregular heart rhythm, you may take Xarelto lifelong as well. Unless you get that rhythm fixed by a certain medical procedure, then it may be a shorter duration, but in general, it can be long-term use with Xarelto. That also brings up that if you do have any surgeries or procedures, even going to the dentist, you want to let them know that you are taking Xarelto because it's a blood thinner, and if they're cutting into you, that could cause bleeding, and Xarelto makes it hard for your body to heal, so you want to let your doctor know about that. So those are the take-home points with Xarelto. I really like it because it's just once a day. It's very convenient. You don't have to check your INR. You don't have to worry about food interactions, so that's really nice. You do want to take this medication with food because that helps your body absorb the medication, and then it can work better for you. Remember to always be monitoring signs of bleeding and to call your doctor if you have any concerns about that. Remember to avoid NSAIDs and use Tylenol instead for pain or fever. If this video was helpful for you, I would definitely appreciate a thumbs up and a subscribe. That helps me make more videos like this and to provide that drug information that I know can be really helpful for people and make you feel much more comfortable and at ease with your health. Thanks so much for watching. We'll catch you next time. I post a video every week, so again, please subscribe to catch those videos. Take care.